Hello, everyone. I'm Nicole. I'm a consultant with Rodan and Fields. And one of the many reasons why I joined Rodan and Fields is that it aligns with my personal interest of taking care of myself. And did you know if you take time every day to kind of invest in yourself, you can change the outcome of your future? Which is what I find so fascinating about our skin. The more you control, did you know that you have more control over it than you think? And that's what we're going to talk about today. So I'd like to introduce you to my friend, Dr. John Sottery. He's a scientist and a PhD from Duke, and he's worked in the product development over the last 32 years and is invited to speak all around the world. And some of the top people in the sunscreen industry have attended his trainings. But what he's really good at doing is translating. He can break down all this complex mumbo jumbo in the scientific world and make it easy for us to understand. So for the next couple of minutes, John and I are going to have a conversation that hopefully will answer these questions. Do you want to age prematurely? 10, 15, 20, 30 years from now, do you want to be at the doctor's office, the dermatologist's offices, getting things cut at, scanned, or scoped? So at the end of this conversation, I'll close us out and talk about next steps, what you can do with all this great information that you just learned. We're going to move quickly. We're jumping right into it, so you can always go back and listen to all the information that you learned. So with that, John, let's get started. So my first question, or do you want to talk a little bit about yourself, or do you want me to jump right into it?
No, let's just jump right into it. That sounds perfect.
Awesome. Perfect. Thank you.
Hello, everyone, by the way.
All right. So the sun, our relationship with it is so confusing. Sometimes it's good to hear that it's our friend and it's good for us. Other times I've heard it's really bad for us. To me, I'm kind of a little bit confused on a lot of that. And I'm wondering if you can help us kind of understand, is there a healthy balance with the amount of sun intake we have in our lives?
Sure. No. Yeah. I mean, I think if you look over the last, say, 30 years, the big focus has been on avoiding ultraviolet light. And I understand why that is. I started working on sunscreens back in 1989. I was at Procter & Gamble. What really grabbed me was we were trying to develop products that would help people, age more slowly. And what grabbed me was we actually had access to clinical work and people that had spent their entire lives indoors. And what kind of blew my mind, I was in my 20s at the time, we found women who never got sun exposure that were 70 years old. And if you looked at their photographs, you would have thought they were in their late 30s or early 40s. It was really compelling. I remember one particular subject that we found, she had she worked outdoors and she always wore the same uniform or outfit. And she had a line right here. And her shoulder, if you looked at her shoulder, you would have thought she was probably, 30, 35 years old. But when you looked at her neck, you would have thought she was 85.
Wow.
So there's just this line of demarcation between the solar exposed skin and the protected skin. And it kind of really, it grabbed my attention. Fortunately for me, I was in my 20s and I said, wow. So my thought on sun is that, first thing I'll throw out there, and that is, if you could look at a photograph of yourself 20 years from now, and I can show you two pictures, and one picture of you looks really good. You look a little older, but you're still you. You don't have all the hyperpigmentation on your skin. You don't have those actinic keratoses, the precancerous lesions. You don't have the deep lines and the fine lines. And then the other picture is, not so good. If I could show you those two pictures, I think you would look at it and say, you do the Curly Howard thing and you'd be like, nah, but you would clearly want to steer, your life towards the you that, that looks better and feels better and so on. So, but that being said, there's been a huge focus on avoiding the sun for the last 30 years. And yet we all evolved, in an environment that has ultraviolet light. And we have defense systems in place to do repair, to repair when our DNA gets damaged, to repair the skin and so on. But we also have a need for ultraviolet light. So On the downside, you get wrinkling, you damage those elastin fibers that in your skin, so your skin can sag. You damage the collagen fibers in your skin. You get hyperpigmentation, which is basically your melanocytes are cranking out all this melanin to try to protect you, but it's uneven on your face and so on. So there's a lot of downside. But on the upside, that's how you make vitamin D. You have a molecule in your skin, a cholesterol precursor. I know you're going to ask me, it's 6-dehydrocholesterol, but that gets converted photochemically in your skin when you get exposed to sun, and that dissolves into your bloodstream, and that's the precursor to vitamin D. So it gets changed a couple more times in your liver and in the final cell, but that's the vitamin D that you need to survive. And so we've driven down our sun exposure, but at the same time, we've also driven down our vitamin D levels. And so one of the things I say to everybody out there, I know we're talking about sun and so on, is that a little bit of ultraviolet is healthy. So you want to get some sun every day, or most days, but too much will give you skin cancer, too much will give you photo-age skin, and you'll look old before your time. So one of the things I always tell people is, get outside and get 5 or 10 minutes of sun, but get the exposure on your arms, get the exposure on your legs. Don't install solar collectors on your face, meaning don't make vitamin D with your face. So I think it's a good idea to protect the face. The areas underneath your eyes are particularly susceptible to photo damage. The tops of your ears, the neck is a big problem too, because when you break down those elastin fibers, I think they call it turkey neck, but your neck.
We actually use that a lot in our stuff in Rodan and Fields. We always talk about the turkey neck. No one says, "Oh, how can I go out today and get turkey neck?" So I think it's real key. Protect your neck, protect those areas underneath your eyes. You normally get linear lines across your forehead, the tops of your ears, and then your hands also get abused, because not only do they get the sun exposure, but then you're washing them with soap and water over and over, which is a good thing to do, but it still does a little bit of damage as well. Yeah.
So
we talk a lot about that our hands. That's what I find so fascinating since doing this, is that your hands actually can show your age more than any other place, and a lot of us don't think about protecting our hands.
Yeah, and sometimes.
Uh-oh, we're losing some technical difficulties here. Hold on for one quick second. Are you still talking, John?
I'm not. Can you?
Yeah, now you're back.
I'm
now
talking
you're back.
now. Can you? Okay.
Sorry about that. I lost you at the hands.
I hate when that happens. Sorry about that.
That's okay.
So the one I tell people is, it's like taking a bath, and that is, you need a little bit of water in the tub, or else you don't get clean. But if you turn the tap on and you overfill the tub, and it flows out into the second floor, goes through the ceiling down to the first floor, and destroys your house, that's a bad thing. So I would say ultraviolet's not evil. You need a little bit to make vitamin D. Your body uses it to make nitric oxide in the skin, which is a nice vasodilator. I believe there's some research that also says that sun exposure improves your mood. Most of us don't need to see a research study. If it's been cloudy and rainy for 5 days and then the sun comes out, your mood picks right up. So
that's why I live in Colorado, everyone.
Yeah. At 5,280 feet. Yeah. So you get extra sun exposure. For sure.
Yeah, we do. We got to protect ourselves.
So ultraviolet is not evil. You need some. And one thing that surprises people is, I have a 7-year-old and an 8-year-old. When we go to the beach, I let them get 5 minutes with no sunscreen, full body. I want them to make some vitamin D. I want them to make some nitric oxide. I want them to get the benefits of it. And then I load them up with a good quality sunscreen. I'm also a big believer in shirts and hats, because those do a great job as well. I wouldn't rely just on sunscreen. It's part of how you want to protect yourself.
So that's actually a good point for us to talk about. For being a sunscreen expert, when I'm looking at my sunscreen, there's a lot of stuff on here. So I'd love to know, what do you look for when you're looking for sunscreen? Sure. Like, what are the right products? And
yeah, I mean, obviously, I'm I'm not going to go out and endorse any products, but so when I'm buying products for my kids and for my wife and I, what I want to find is I want something that's going to give me UVA protection. And I'll try to talk English here. So UVA are the wavelengths from 320 to 400 nanometers. And they're the longer wavelength ultraviolet photons. They go deeper into the skin. They tend to damage the dermis. They tend to damage those elastin fibers and those collagen fibers. And they also appear to be implicated in melanoma as well. So you really, and in the US market, there's only one organic sunscreen that blocks that, and that's avobenzone. And it's actually butyl methoxy dibenzoyl methane, because I knew you're going to, sorry. But avobenzone blocks, ultraviolet, let's say out to about 370 nanometers, and it does a good job. So the first thing I look for, I want a product that has avobenzone. Okay. If it's an inorganic sunscreen, I'm looking for zinc oxide and titanium dioxide. Inorganic meaning it's a particulate sunscreen. An organic sunscreen is just an organic molecule which is clear on the skin. So I'm looking for something with avobenzone, and I want to make sure that the other thing I'm looking to make sure it doesn't have is I'm not a big fan of oxybenzone. Oxybenzone is a sunscreen. It's been around since it was in wide use in the 70s and such. Gotcha. I don't like oxybenzone. I don't, based on the FDA regulations, you can put up to 6% in the formula. I don't think it would be approved today if it went through the scrutiny. And so I don't think it's a good choice. So I make sure that I pick things that don't have oxybenzone. And then if a product has avobenzone, I also want to have some octocrylene in there. And octocrylene is a good molecule in that it photostabilizes the avobenzone. So bottom line is, if you're wearing a bulletproof vest, you don't want the vest to break down over time. You want it to keep protecting you after an hour, after 2 hours, and so on. So you want a formula that's photostable. So I look for no oxybenzone. I like avobenzone as a UVA sunscreen, or you can also use zinc oxide or titanium dioxide. And
so the ultimate question everyone's going to ask is, how does this bad boy stand up to when you were looking at?
Oh, okay, yeah. So when you asked me to go on, I actually got on the web and I went through all the ingredient statements on all the products that you have, because I wanted to make sure I felt good about them. Yeah. And you guys do not use oxybenzone based on all the products that I reviewed. You do use avobenzone, and you do use octocrylene to photostabilize it. So I was very happy to see that the products were very intelligently formulated, and that they look good. So yeah, they pass. I call it the A to Z test. So would I put this on Angelique and Zachary, my 8-year-old and my 7-year-old? So
and my loves. I love my niece and nephew.
They're sweethearts. Yeah.
So that's actually something for us to think about, is that a lot of my preferred customers, we have people that have that were in the 60s and 70s that were using baby oil. Sure. And now they're the ones that are kind of, they're really good about telling me, like, you need to be taking care of yourself. And that's what I love about Rodan and Fields, is that I'm very attuned to that. I've got a lot of my friends in my age group that have little ones. And so for our younger ones, that's where I'm kind of trying to also advocate of, like, especially if you're, like your 20s and 30s, like start, taking care of yourself. So kind of, I know it's kind of a multi-layered kind of question, but just thinking of all the different types of generations, what are things for all of us to, daily things we can start to think about on best practices, not only for ourselves, but for our loved ones.
Yeah. I mean, when it comes to sunscreens, you never want to get a sunburn. You never want the skin to turn red. So to figure out how much sun you should get that's healthy, depending on where you live, how far from the equator, and what your skin type is, meaning people that have more melanin in their skin, it takes longer for them to make vitamin D. If you're very fair skinned, then you make vitamin D very quickly. But you never want to get to the point where you start turning pink or sunburned, but a little bit of ultraviolet is healthy. And for kids too, I think a lot of kids are so completely covered up and so protected that it drives down their vitamin D levels. And in fact, I'm going to make a point separate from sunscreens. I would suggest everybody out there, if you don't know what your vitamin D levels are, the next time you go to the doctor, you got to get them to check that box. there's a box for 25 OH vitamin D on the lab test, and you want to get your numbers. And the normal range is from 30 to 100 nanograms per milliliter. So 30 to 100 nanograms per milliliter. I really think you want to be in that 40 to 50 range based on all the data. And you're going to substantially reduce your risk of many different cancers. And real quick, I read a study about 2 years ago down in Australia. They looked at 200 people that presented with melanoma. And the people that had very low vitamin D levels, their risk of having a very thick melanoma went up by 200 to 300%. And it's not that vitamin D prevented the melanoma, it's that it activates your immune system so your immune system can fight it more effectively. Because melanomas kill you when they grow down into the blood vessels, and then a cell, some of the cells metastasize and they go to your brain or your liver or your lungs or something. So that's what kills you. So you really want to optimize your vitamin D levels and really interesting, outdoor workers have a lower rate of melanoma than indoor workers. Wow. So that also, because outdoor workers, I believe, have higher average levels of vitamin D. So you really don't want to be down below 20. Most Americans are between 20 and 30, and you really want to get up above 30, and I think preferably in that 40 to 50 range. Now, if you're African American, I probably think you want to be in the 30 to 40 range. But you want to make sure your immune system is out hunting cancer cells, and it's not just melanoma. There are 7 or 8 cancers that decrease dramatically when you get your vitamin D levels up to 40 nanograms per milliliter. So you guys can Google that. We don't have to spend any more time on it. I'm kind of on a little. The other thing which is important, and that is with ultraviolet, it's not just making the nitric oxide and the vitamin D. You also want to get some UV into your eyes every day. So if you wear sunglasses, pop them off for 2 or 3 minutes and get a little sun in your eyes. Now, your eye doctor is going to say, oh my God, you're going to increase your risk of cataracts. But what you're doing is you're going to help reinforce your circadian rhythms. So you're going to tell your body it's noontime and this is the peak in the sun. And then at night, you want to avoid all the blue light. And then your body knows that it's nighttime as well. So also, if you have an iPhone, shift it to night shift mode, meaning on the bottom of the phone, if you bring up the screen, you want to make sure that you shift it, because the iPhone will actually take out the blue wavelengths at night so it doesn't screw up your sleep as much. Unfortunately, all the light bulbs in your house don't have that adjustment. Yeah. So you really want to avoid blue light at night, but you want to get some ultraviolet at your eyes, just a few minutes every day. So I wear sunglasses, but I'll pop them off for 5 minutes when I'm outside.
And that's what I find so fascinating about all of this is how much the sun and all the UVs and everything, how it's just not the exterior, and it can go into all the other, layers deeper into it. So I think that's what just is so fascinating. And I think with skin, I think it's a living organism. And I know that we were talking about it. It's ever changing. And kind of like, I guess, for us, and we were talking about it, you and I, like exfoliation, like why is that important? Like cell turnover. I'd love to hear your kind of thoughts about that.
Absolutely. So if you have a car and the car is 40 years old and it's been parked outdoors in the sun, the paint's going to look pretty bad after 40 years or 30 years or whatever. Right. Because the car doesn't repaint itself all the time. Now, the cool part about the skin is that every day you create a new layer of skin and you lose the top layer of dead cells. So generally, you're going in a month, you've gone through 30 layers of skin. So in the epidermis, those cells are replicating and you're producing cells, and then they flatten out and become your stratum corneum. So one thing you can do is you can use products that feed those cells in the epidermis to try to get them to produce more cells. That's a good thing. Those are all the treatment products, products that are based on retinol or other technologies to try to feed your epidermis. But the other approach is if you use something that's exfoliating and take off the top cells, it actually sends a signal down to the epidermis and says, make more cells. So I really like both approaches. I think you should exfoliate your skin every day, and at the same time, use something topically that's going to nourish those cells in your epidermis and help them, increase that rate of cell turnover. Yeah. So
Which is great. And we do that a lot with a lot of our stuff, is like the exfoliation,
Sure.
but also regeneration. Another thing you and I were talking about, because
Yes.
especially for a lot of my friends in my age range, our faces are, I don't know what's really happening. Like there's things that are like it feels good, but it's starting to, there's things that are maybe hanging a little bit more. And I'm like, so we talk a lot about this collagen and this new word that's coming into our vocabulary. And I'd love for you to help explain this.
Sure.
The elasticity, why is it going away? How do we keep it?
I mean, if you like, my son is 7 years old, and you press on his skin, and his skin is beautiful, and it has all those elastin fibers, and it springs back, and so on. But I would say, picture you take an elastic band and you hang it up in the window for 6 months, and then you go and stretch it. Usually, after 6 months, when you stretch it, it doesn't snap back, and sometimes it breaks. So ultraviolet light, when it strikes your skin, those are high energy photons. They can produce free radicals, and those free radicals can then damage those elastin fibers. And it's particularly problematic for your neck, for those areas underneath your eyes, especially this area right under your eyes here, because the skin is so thin, it doesn't take a lot of damage to cause a lot of problems. So sunscreen is going to help you protect those elastin fibers. It's going to help you to protect those collagen fibers. And it's going to help your skin look, plumper and better, and so on. And then there are topical things that you can apply that can also increase the rate of collagen production in the skin. But really, it's UV damage to those elastin fibers, which makes your skin, sag more. In fact, they've done animal studies, and they've shown the longer wavelengths, actually the ones that penetrate more deeply, are the ones that are implicated in what they call UV-induced skin sag, which is definitely something that you probably want to minimize or avoid. Hey, that reminds me of one other thing, and that is, a lot of people tell me, hey, John, when I was like 15 years old, I never sunburned, but now that I'm 35 or 40, I sunburn more easily. And their first thought is, oh, it must be the ozone layer. And what people don't realize is every time you get sunburned, the redness in your skin is capillary leakage. So you're actually seeing hemoglobin or blood, that's in your skin. And hemoglobin has an iron in the middle. And iron is the catalyst that produces the hydroxyl radicals in your skin. And in a simplest way to think about it, the hydroxyl radical is kind of the Mr. T of free radicals. And whatever it runs into, it wants an electron in the worst way. And the first thing it runs into, whether it's your DNA or an elastin fiber or a collagen fiber, or the lipids that make up your cell membranes, it's going to rip an electron off of that, and it's going to damage it. And I always tell people, in terms of free radicals, I say, okay, you have 100 kids out on the playground, and they're in Green Bay, Wisconsin, and it's 40 degrees below zero, and everybody has mittens on. So the photon comes in and knocks off one of those kids' mittens. It doesn't just damage that molecule. What's that kid do when his hand is freezing and he needs a mitten? He looks at the kid next to him, and he rips a mitten off that kid. And then that kid does it again. So the first photon hits, that's free radical initiation. That's chain initiation. And then every time one kid steals an electron from the next kid or steals a mitten, so you end up with 100 kids that all have frostbite because one photon hit and 100 molecules are damaged. Now, what do you want to have happen is, first of all, you don't want that initial, free radical to be created. But secondarily, you want to have a molecule, an antioxidant, that can give up an electron without becoming a free radical. So you need a teacher on the schoolyard that can hand that kid a new mitten, so he doesn't have to go out and continue that chain propagating and doing all that damage. So that's why eating things that have a lot of antioxidants, the green leafy vegetables and the astaxanthin and so on, those molecules have the ability to give up an electron without becoming a free radical themselves. But what I was getting at is the iron in the skin is what creates that hydroxyl radical. So we did some work. We had a patented molecule back in the late 80s. And we showed that if you chelate the iron so it's not available and it's not catalytically active, you could go out in the sun and get no sunburn. So even though the photons hit, because I won't get into the chemistry because I don't want you to go into a coma.
Like,
so
I don't know. I don't know what he's talking about.
so coming back a little bit, step one is avoid the damage, particularly to the areas that are really susceptible.
Okay.
And then step two is, it's all about the rate of damage, which is the down escalator, and repair, which is the up escalator.
Gotcha.
So you want to minimize the damage, you want to maximize the repair. And if you do that, you're going to age a lot better. Now, everyone's going to age,
right,
but I'd rather, 24 months, I'll be 60. I'd rather not age. I don't want to look like an average 60-year-old or below average 60-year-old. And I don't want to go to the dermatologist and have them freezing off all those precancerous lesions and those actinic keratoses and so on. So I do think if you could see a picture of yourself in 20 years, there's no question that you would take action. But the problem is when the pain doesn't happen immediately. When you put your hand on a hot burner, you learn that one quickly. When the pain doesn't come for 5 years or 7 years or 10 years, then those are the ones where you have to be smart about it and steer the ship away from the iceberg. And you don't want to hit the iceberg to find out that, geez, I should have done this or I should have done that. So
I love this. This has been so awesome. And I love that the face is a very big focus on all of this. So I want to wrap this up really kind of quickly. So if there's one or two things that people for like a little nugget of information in a minute, can you summarize like, what do I need to remember in taking care of myself and protecting, like how much sunlight, whatever you think would be good information for us to kind of.
Yeah, well, it's all about ultraviolet's all about the dose. So you want to get a little bit of sun every day. You want to get a little bit of sun in your eyes, maybe 5 minutes. You want to get some sun on your arms and on your legs. You don't want to avoid sun exposure on your face. I like to, hats are good. Sunscreen that has avobenzone or zinc oxide in it. Those are good choices as well. And you want to increase the rate of cell turnover in your skin. You want to help the skin repair more rapidly. So I think exfoliation is a good move. Okay. I also think that, some of the treatment products, those are real. They help, reduce fine lines. You really need to do both. You want to minimize damage, accelerate repair. But totally being afraid of the sun and being totally covered up and covering up your kids completely is not healthy. I would definitely, as a take-home point, get your doctor to check that box for 25 OH vitamin D. You need to know where you are, and maybe you're not going to make it all via the sun because you live in Maine or you live in Alaska or you live in Philly. And in the wintertime, the sun never gets high enough in the sky. So maybe you have to supplement with vitamin D. But you want to make sure that you have good levels of vitamin D. And I would just take a second and picture yourself in 5 years, picture yourself in 10 years, and just say, where do I want to be? We actually worked with the Cheeseboro Ponds back in the 90s, and they launched a product called Prevent and Correct. And I thought about it, and I said, the only way to convince people to use sunscreens is actually to take a high-resolution photograph of them, put it up on a big screen, and then using some image analysis techniques, find all the fine lines that were barely visible, and then age them on the computer. And I'm telling you, it was incredibly compelling. Yeah. Now, not everybody can do that, but when you see yourself aging differently, it's like, whoa, I don't need to do that. I don't want to do that.
Yeah.
But,
and I think that's why we, in Rodan & Fields is always, we're about like, take a photo before you start using the products and check it out, within 30 days, 60 days, a year from now. And it's mind blowing, what people are able to do with this. So this is awesome. So thank you. And thank you for all of this amazing, great information. There's so much in there for us to incorporate into our daily lives. But for me, it just iterates why I love, Rodan & Fields is because our products right behind me, incorporate the sun protection already built into our regimens. And as you said, you don't want to put reflectors on your face. You want to protect your face. And that's what exactly these regimens do, which are reverse, soothe, redefine, and unblemish. But I also love what you said is that, simple everyday decisions, you have the power to determine the outcome of your future. So, my fun scientific fact is that, 20% of this is genetic, that mom and dad gave us. So that means 80% of this is in our control. So that's what I want to iterate to all of my friends and family that are watching this, that you really do have the power, to change the outcome of your skin. And so with that being said, what are you going to do now? So
you're steering your own ship. You decide where you want to go to. But it's so, it's so true. And, you don't want to be one of those people that, in 5 years looks back and says, I shoulda, coulda, woulda. I mean, if you make the moves now, you can be in a different position. So
totally.
So
what we're going to do to all of our friends and family is we're going to have a challenge for you guys, is we want to see, based on the information that you learned today, how are you going to start incorporating that into your life? So between now and the middle of August, so August 15th, I'd love for you guys to start, sharing stories with me, taking photos. You can tag me in Facebook of how you're incorporating information that you learned from this session. And we'll be watching. And so there's going to be incentive. So for those that, the more stories you share, you're going to be entered into a raffle. And that raffle is, you get to win, is a free regimen. A free regimen. So for all my preferred customers, that's a big deal. For those that have no idea what I'm talking about, that's a retail value of $180. But really what we want you to do is just start practicing. And you don't have to be using Rodan & Fields products. I want you out there just, as John said, with hats on, glasses, vitamin D, going to the doctor's visit, eating your iron. But if you are using Rodan & Fields products, I will up the ante. So if you're out there, you give me photos, you're entered into the raffle. If you're using our products, you'll get 3 entries into the raffle. I'll do a live drawing on the 16th of August. And then one other thing, for taking time out of your day to join us between now and the end of July, anybody that, purchases a preferred customer, as a preferred customer, or joins as a preferred customer, as a thank you, I will send you a complimentary Rodan & Fields sunscreen. So out there protecting yourselves, drinking your water. But most importantly, how I want to close this out is I just want to thank you for taking the time to show up, taking time out of your day to learn more about how you can live a healthy, more engaging life, especially as it pertains to anti-aging and the sun. But John, thank you. Thank you.
There's one other thing that you can save someone's life if you know this. It's really simple. It's just ABCD. And that is, melanomas don't kill you. It's when they metastasize. So I didn't mention this before, but you could just go with the ABCD, and A stands for asymmetry. So when you see something on your skin that's not symmetrical, if you see a mole on your skin that's not symmetrical, that's bad. B stands for border. So if the border is irregular, that's also a bad sign. C stands for color. It's not that helpful because they can be black or brown. It can be underneath your fingernail. It can be on the bottom of your foot. It doesn't have to be on a sun-exposed area. And then D stands for diameter, which is like 6 millimeters, which is about the size of a pencil eraser. The key with melanoma is it's a hand grenade, and the pin has been pulled. You have a certain amount of time to get it off you, and you have a 100% cure rate. It's when you sit there and you're in denial. So if you see something that meets any of those criteria, you probably want to just pop it to the dermatologist. Even if it's a melanoma, you get it early, 100% cure rate. Do not gamble your life in denial. Just, if you see that, ABCD, it's easy. You can Google it, and you can see it on someone else. And take a look at your husband's or your boyfriend's or your girlfriend's back, and keep an eye on it, because most people can't really monitor their back. So just want to leave you with that. You have the tools, and more people got melanoma last year then attended the Patriots' incredible Super Bowl victory.
He's
So
from, he's from
you could
Boston,
have
everybody.
you
And
could have
I
filled
remember,
up that whole stadium with the people that were diagnosed with melanoma in just the United States just this year. It's
wow.
scary. So
And that
please,
might
and
be, and I was going to say, that would be a good conversation for us for next time, because we got to
sure.
close out this session. So if you have any questions for me or Dr. Sottery, please contact me. And John, thank you, thank you, thank you, and thank you. And I think hopefully we can do another session because I'd love to go deeper into that
Yeah.
topic. So
And
yep.
just so you guys know, I'm doing live health seminars on Facebook. It doesn't cost anything. I'm just trying to get the word out on how to avoid calcifying your arteries or how to avoid dying from melanoma. So if you're interested, look for me on Facebook and check out some of those videos. And hopefully I don't get too heavy into the science. I spend more time translating, but as a scientist, you'd love to get into the molecular side. So
Awesome.
I had a great time. It was fun, and
Awesome.
I hope that people find this beneficial. If you do, share it with somebody that you know, because especially if you know people that are fair skinned, the sun a little bit's good, too much will kill you. So it's a balancing act. So
There you go. And we'll end it on that, everyone. So
great.
thank you. Talk to you guys soon. Bye.
Thanks. Bye bye now.